Welcome to Development Desk, a space where parenting meets psychology, advocacy meets action, and insight replaces the noise. I'm Anna, a school psychologist and mom, sharing what I've learned from years inside the system and alongside families. Together, we'll unpack the why behind the behavior, decode the school processes, and build something strong, one conversation at a time. From insight to action, from chaos to clarity, this is Development Desk. The information shared on Development Desk is for educational and informational purposes only. While I am a licensed school psychologist, this podcast does not constitute psychological services, legal advice, or therapeutic relationship. The views expressed are my own and do not reflect the policies or positions of any school district or employer. This content is not a substitute for professional consultation with a qualified provider in your state. Always seek appropriate support when making decisions related to your child's education, health, or legal rights.
Thank you.
I have Dr. Ashley here. She's a board-certified
Family medicine physician. There you go. I'm a doctor.
I'm still working on the titles. You do specialize with menopause.
Yes. So midlife women's health, menopause care, specialty, or just general interest of mine as well.
Okay. The reason why I wanted to have you on here is because I have a lot of moms that listen to this podcast.
Mm-hmm.
And I think that a lot of the information you've been putting out on your social media and then just us talking at happy hours.
Yes. Mom too. Fellow mom, 2 twins.
Yes.
Little girl. So yes, definitely in the thick of it.
Right. Yes. Little ones. You have
Yes.
little ones. So you can definitely relate to motherhood and all the hormones and mood changes and things that we are going through. And the reason why this topic is so important to me and I wanted to bring you on is that a lot of us moms tend to put our health in the back burner. And we're constantly listening to or digging into how we can make our kids' lives richer, and then we forget about ourselves. But a happy mom is a happy kid.
Yes.
And a happy mom also brings about happy childhood memories.
Yeah, that's right. Instead of scary ones.
Yes. So I wanted you to really talk about what are some hormone fluctuations that maybe us women don't look into. It's not really too popular yet. I know that it's going to be. And then also another reason why it's close to home is my mom also went through menopause very early. And even at that time, I think I was in middle school, there was very little education for women in her situation. And she had all these mood fluctuations, all these health issues going on. She had no idea where to go or how to be supported. And I feel like a lot of moms can benefit from that.
Sure.
So that's why this topic is so important to me. And I think that it's really relevant to our audience.
Great.
First,
Great.
what hormonal, and this is going to be just really broad just to kind of get us started.
Sure.
What hormonal stages, postpartum, perimenopause, menopause, do most women do not realize are impacting their mood, energy, and patience?
So I think that's a really good question. I think some of them are pretty obvious. I think most of us, if we think back on our postpartum lives, are like, oh yeah, that was kind of crazy.
Yes.
Like you're sleep deprived. You know there are hormonal fluctuations, right? Like I can remember my own husband, several spouses coming into the office. They're like, she's just crying for no reason. Like what is going on? And even like yourself, you're like, I don't know. I'm just crying. So I think postpartum, most people are pretty attuned to, okay, this is not myself.
Right.
And the similarities between postpartum and menopause are actually really similar. They're both times where your estrogen just plummets off a cliff. And so again, when you're in full-blown menopause and you're having a lot of symptoms, I think those, especially when they're vasomotor symptoms, so hot flashes and night sweats and things like that, I think those are pretty obvious to a lot of people. But that is literally just the tip of the iceberg. So I would say out of the 3 times that you mentioned, and I'll even include your normal, even before perimenopause, just your normal menstruating years, that it's perimenopause in those years that people really kind of forget about their hormones. So perimenopause, which is the period. Okay, so let's do some definitions here. So menopause is the one day in time when it's been 12 months since your last menstrual cycle. Okay, so it's just one day. Everything after that day where you're not having periods, that's when you're postmenopausal. Everything before that time is when you're premenopausal. Okay. So notice that I said 12 months after your last period. So that means even if you haven't had a cycle for 6 months, you're still premenopausal at that point. There are a bunch of hormone fluctuations that happen anywhere from the 5 to 10 years before that last menstrual cycle. And this is where a lot of those really typical symptoms like hot flashes, night sweats, vaginal dryness, the things that we kind of think about as menopause can happen. So think about the timeline of that. The average age of menopause in the US for a Caucasian female is around 50, 51. So if you're going to start having symptoms, and so that's an average. So that means anywhere from like 45 to 55. Okay. So let's say on the earlier end, 45. Okay. If you start having symptoms 5 to 10 years before that in perimenopause, that means you can start having symptoms as early as 35.
That just blows my mind.
Yeah. I mean,
we don't hear that
too. I know. I'm almost 40 and I'm like, oh shoot, I could have been having some of these symptoms. And it's so important because it's not just hot flashes. It's things like brain fog, fatigue, irritability, new onset mood swings, like anxiety, depression, all of these things that a lot of us moms are going, well, maybe it's just, or that we're being told, not just that we think, but that we're being told, especially by providers, well, you've got kids, you've got a busy life.
Right.
You're probably just stressed out because of that.
Yes.
But it can be your hormone. And then again, during those normal menstruating years, migraines are a great example. For my patients who have migraines, some of them are very affected by their normal cycle fluctuations in their hormones. So the few days before their cycle, when estrogen and progesterone just drop, people can be really sensitive to that. Or again, what we just kind of chalk up as PMS type symptoms.
Right.
That can be it. And so I think a lot of that is, again, we're just sort of sucked into this narrative of like, well, we're just busy moms. And so therefore you're just tired or postpartum wise, like, well, you're just not sleeping because the baby is getting up. And all of those things are true. But your hormones can be a huge role in that. And I think too, when we're really busy, we may not be really picking up on those cyclical fluctuations because again, if they're only happening once a month, girl, I can barely remember like what I did yesterday, like let alone like a month ago.
Yeah.
So unless you're really like logging and kind of keeping track of those things, sometimes it takes us a really long time to realize like, oh, maybe this is related to my cycle.
Right.
Especially if those changes are happening maybe in the middle of your cycle, not when you're bleeding, right? So I think it can be across the lifespan of a women's, again, menstruating, perimenopause, menopause, postmenopause, all of those things. Again, postpartum too.
Yeah, I never thought about the perimenopause stage and how it can happen so young. I'm like thinking, well, sometimes I still think of myself like in my 20s. And I'm 36 now. And I'm like, okay, these are some things I need to start educating myself about and thinking about. And I started having symptoms of my own. And again, I'm putting it off as it's stress. I'm working so much. I've got the kids, just like you said. And then instead of taking care of yourself, you're just kind of pushing it off and pushing through instead of stopping and thinking that it could be something more.
Yeah.
I think to me, that's the most shocking is the perimenopause age range.
Well, and so the other thing to think about too, so again, you mentioned I have young kids. Again, a lot of medical professionals, because of our education, we have kids later, but overall in the country, we're all having kids later, right? So
true.
Then you have to think about, oh shoot, okay, well, so now that postpartum period is starting to really butt up against that perimenopause period.
Oh, yeah.
So now, again, I had my daughter when I was 34, and I had my twins when I was 36.
Which is average now.
Yeah. And so again, if those perimenopause changes, which obviously I wasn't in perimenopause then, I got pregnant with 2 babies at the same time very easily. But so obviously my ovulation was doing just fine, but can you imagine if I was in that perimenopause phase already? I came out postpartum and then just dropped straight into perimenopause. These periods in our life, because we're having kids later, are starting to abut a lot more closely than our parents did when they had kids in their early 20s.
I didn't think about that.
And then they get all these years of just kind of normal, again, cyclical flow. And then there's time before that. So I really think, again, I think the underlying, theme of this conversation needs to be, this is something to consider. So again, it's not, oh, this isn't going to be the reason for everybody, but this does need to be something to consider. And don't just put off your symptoms. Like, trust yourself. If it feels like something is coming out of nowhere, that's usually a question I will get when we talk about perimenopause is like, okay, well, you listed all these symptoms. Yes, I'm tired. I'm fatigued. I'm having mood swings. I'm doing all of this. Well, how do I know it's perimenopause and not something else? And I think the biggest takeaway is if it seems to have come like out of the blue. Again, for most women, again, who go into this phase, this is something, it's not something that's been chronic and kind of ongoing where, I'll use myself as an example. I am a very type A. I mean, I'm a doctor, right? So I'm very type A, very organized. I've always had sort of an anxious personality or anxious tendencies. And so me making the decision to start an anti-anxiety med wasn't out of the blue for me. It was, again, I've had these kind of tendencies for a long time. Then I put 3 small children on top of it, a busy medical practice, all these other things. And then I kind of realized like, okay, I'm at my peak now where I need some support of some medicine. If I've never had any of that before and all of a sudden I wake up and I'm just like feeling just completely overwhelmed. And I'll have women who come into my office at 50 or 55 who are the calmest, most chill, badass businesswoman managing all the things with no problem. And then they come in tears going, something is wrong with me. I hate my husband. I hate my spouse. It's out of nowhere. And they're like, I do not feel like myself. That's out of nowhere, right? So if this is something, if you're having symptoms too, where you're like, oh, I'm feeling really tired, but you're only getting 5 hours of sleep at night, guess what? That's not your hormones. Although that lack of sleep is affecting your hormones.
Right.
So that's what I would say is if this feels like it's coming out of nowhere, you need to look into it and pay attention to it and don't just like brush it off.
And find a physician that listens to you. It's been really hard for me to find a physician that listens to me because, I have lived a fairly healthy lifestyle compared to the average American the last 15 years, where I try to, for the most part, again, with kids, prioritize my sleep, prioritize my fitness, eating healthy or balanced. And then when I go to a physician and I tell them these things, they're like, well, your lab work looks great. I think it's just, I don't know, maybe it's just your cycle. Like maybe it's, like you said, maybe it's just PMS, you're fine. And it's so hard to find a physician that really takes the time to figure out what's going on. Why do I feel off? And I still haven't found one, so I need to go to you.
So I will I love this point, and I'll make a bunch of different comments on it. So number one, yes, I tell every single one of my patients that come in just for a new consult, hey, I'm not everybody's cup of tea, okay? And that's okay. There's a ton of us out there. You deserve to find somebody that you mesh with. So you really want to find a partner that's going to be part of your team that you feel comfortable with, that you don't feel like you're having to lie to or like perform for or say what they want to hear. And that looks different for everybody. I mean, I have patients who, again, are very involved in their health, but they're just looking for a different approach that I'm not trained in. So there's no point in finding somebody that you're going to be butting heads with and arguing with back and forth. The other point I'll make is with the current setup for the insurance system, it makes it really hard to have these in-depth conversations in a 15-minute office visit.
Yes.
It's terrible because we're not going to have time to get to, again, like sleep, for example. We'll just keep going back to that one because guess what? There's not a lab test for it.
Right.
And sleep can be so multifactorial, not just how much are you sleeping, but are you feeling fatigued during the day? Are you snoring at night?
Is it quality sleep?
Is it quality sleep? Right. And so these conversations take time. And so, especially with the way the current system is, an insurance-based model is getting paid every time you come in for a complaint. So the first visit is just going to be like, okay, well, what's going on? Well, what we have left to do after you tell me everything is to go, okay, well, let's check some labs and see if there's anything there. And then if there's nothing there, it's either going to be another visit, which is another copay, time out of your day. It's just constantly, more and more and more. And so,
Right.
and then two, if you're not seeing the same person every time, so if the office you're
Yeah.
going to, you see, a nurse practitioner one day or a different provider, anybody
Right.
else, then you're having to start the story all over again.
Right.
And you oftentimes aren't going to get to the gist of it. There's also not a lot of, it's becoming more popular, but there's not a lot of providers, myself included. I did not get any midlife kind of women's menopause training in medical school because we were prescribing hormones then because of this big women's health initiative that came out. Everybody was kind of scared off of hormones. We weren't prescribing it. Therefore, we're not going to be teaching things that aren't being done. And so providers are having to take it into their own hands to get this education themselves. So it's not that they don't want to be able to help you, but it's that they're limited on time. Labs only tell part of the picture. Again, there's not a lab for sleep.
Yeah.
There's not a lab for a lot of different things. And then two, they may just not have the education. So you can start with your primary care doctor. That's a good place to start. You can, for some people, especially when you're younger, we use our OB-GYNs as our primary care doctor. So that's another good place to start. Although I will say I was surprised when I was referring patients out to the OB-GYN because as a primary care doctor, I mean, again, I have OB-GYN training, but for more specialty things or things that I don't know about, I'm going to say, hey, go see the OB. Those patients were also coming back going, well, they just kind of blew me off or,
It's very true.
tried to stick pellets up my butt or, something, that's a whole other story. But, they didn't know either. And, I remember too, postpartum, going back to that, I was nursing my twins and kind of having issues. And I remember asking my OB-GYN, who I love, I said, oh, like, what do you know about like breastfeeding? And they're like, to be honest, like, we don't know a lot unless it's something like a personal interest of ours. It's not part of, they take care of you all the way up and through pregnancy. And then that baby comes out and then that's somebody else's kind of issue. And so she was very candid, like, unless it's an interest or unless your doctor has, nursed her own babies, that's where a lot of our education and stuff comes. So,
Right.
so if anything, I'm coming up on perimenopause and menopause. So like, I'm going to be going through it. So I better know what's going on because I may have to be my own practitioner or, at least be an advocate for my own health. So
That's really good to know that background knowledge because a lot of times we go to doctors thinking, well, they know everything. They've gone through all of this and maybe they just have gotten some general education, but not that specialized training, like you said. And that's really, really good to know.
So endocrinologists are going to be your hormone expert as well. So again, if we do suspect a hormone issue, and that includes anything from PCOS to menopause care to a pituitary issue, a thyroid, diabetes, all of those hormone issues. If your primary care or your OB-GYN, if it's beyond their scope or we're needing more specialized care, an endocrinologist is who you're going to be looking for as far as a specialist. So your primary care and OB-GYNs are a good start. But if you're really suspecting a hormone issue, an endocrinologist is who you're going to be looking for.
Do you usually need a referral for an endocrinologist?
It depends on your insurance, but most of the time, yes. So if you normally need, they're not considered primary care. So again, a primary care and OB-GYN, those both fall into primary care. So an endocrinologist is specialized. So usually they're going to require a referral.
Okay. That's really good to know.
Yeah.
So with the hormone fluctuation, is this impacting also executive functioning, maybe decision making? Yes.
Yes. Unfortunately, yes. It's affecting our brains. So estrogen specifically is a really good example of this. So estrogen's responsible for your levels of dopamine and serotonin support in your brain. So we think of serotonin as kind of your happy, hormone. But again, when estrogen drops off, this is where you're going to be thinking about things like, okay, you're having brain fog. You can't concentrate. You'd be shocked by how many women in their midlife years come and go, I think I've developed ADHD. Do you know, you're very familiar with, and they're
yes.
like, I've never had this issue before in my life.
Yeah.
Like, I'm managing a busy practice and I cannot read a paragraph without having to go over and read it twice. I
Yeah.
don't know what's going on.
Yeah.
So all of those kind of symptoms, especially, can be affected by estrogen for sure. And again, just remember, you have, even when you're having normal cycles, your estrogen and progesterone drop off right before your cycle starts. So some people are very sensitive to that drop off. And so they may feel the few days before that may be kind of their primary sort of PMS symptoms, is that all of a sudden they're not sleeping well, they're super irritable. When you're irritable, anxious, not sleeping well, even just the sleep, I keep going back to sleep because imagine, you remember, if you haven't had a great night of sleep, you're more irritable, you're more anxious the next day, you're more quick, on your kiddos and stuff like that.
Yeah.
And so that just becomes hugely important. And so in perimenopause, your hormones are just all over the place because you still have some egg reserve. So some months your body does its normal cyclical thing that you're expecting. And then other months, it's sending out all kinds of crazy hormones to kind of get things going. So it can be all over the place. And this is another really important point that I wrote down in my notes to make sure to emphasize is women are really good at talking ourselves out of our symptom, because we will have one good day and we'll be like, oh yeah, that must have been a fluke. I'm totally fine.
I'm good.
I don't need to make that appointment. Everything's fine.
Let me cancel that appointment.
Let me cancel it. Yeah. And then as soon as you cancel it, the next day it's back, or, a month from now, or again, your kids have to go, to the doctor or something. And so again, don't let perimenopause gaslight you into thinking that you're crazy. Because again, you're not, but your hormones may be. And